Hello and welcome to our information video on Diastasis rectus abdominis. For the purpose of this video, we will now refer to this as diastasis. We will be going through lots of advice and strategies to help you manage your abdominal muscle separation from your pregnancy and any discomfort you may experience. In pregnancy, the tummy and abdominal muscles stretch to allow room for the baby to grow. Sometimes this causes the muscles to separate along their midline. The muscles affected are the six-pack muscles, or rectus abdominis muscles. You may notice a gap, particularly when sitting up from a lying down position. When this happens, you may see a visible peak, or doming, and this is what you may hear referred to as a tummy gap or diastasis. Diastasis is common after pregnancy. It does not usually cause a problem, and in most cases, the muscles come back together within a few weeks postnatally. This happens more commonly if the baby is large, if you have a twin or triplet pregnancy, or if you have had several pregnancies. This diagram clearly shows how the tummy muscles form an important part of your core control. Your core cylinder is made up of your diaphragm muscle at the top of your abdominal cavity, your rectus spinae muscles at the back, your pelvic floor muscles underneath, and your abdominal muscles at the front. These muscles work together to help provide stability and control when you move. This is how you can self-check for diastasis. Lie on your back with your knees bent and feet flat. Tuck your chin in towards your chest and gently lift your head and shoulders up as you breathe out. If you have a diastasis, you may see doming down the middle of your tummy. Have a feel of your tummy. Can you feel a gap in the middle that is wider than 2 fingers width? Or do your fingers sink deep into your tummy? If so, you may have a diastasis. If you have a diastasis, then you need to follow some do's and don'ts. Avoid exercises that make your tummy dome. Avoid heavy lifting or bending. If you have to lift, make sure you lift correctly. Avoid constipation and straining on the toilet. Avoid aggressive tummy exercises such as sit-ups and crunches. When getting out of bed, roll onto your side, then push up, avoiding the sit-up motion. Tubi grip or stomach supports can be useful initially, but not for a prolonged time. Try to stand and walk as tall as possible, improving your posture. When sneezing or coughing, initially support tummy muscles with your hands and engage your pelvic floor muscles. Start exercises to strengthen your abdominal muscles. Diaphragmatic breathing can help to engage and mobilise the core muscles. Here is some advice on how to perform a diaphragmatic breath. Lie on your back with your knees slightly bent and head supported. Place one hand on your chest and one hand on your abdomen. This little trick will help you know if you are performing the breath correctly. Breathe slowly through your nose and allow the air to flow from your chest down to your tummy. As you take a deep breath in, the hand on your chest should remain still as possible, while the hand on your tummy should rise. It's important to note that you are not using your abdominal muscles to push out your stomach, but rather allow the air to fill the tummy. Exhale slowly through your mouth and allow the tummy to recoil back down to its resting position. The hand on your chest should continue to remain as still as possible. You may feel your pelvic floor relaxing down with your breath. This technique will improve with practice. We recommend you practice diaphragmatic breathing at least 5 to 10 minutes, 1 to 2 times a day, and try to incorporate this belly breathing throughout the day to help counteract any tension that may be accumulating. You can further help facilitate pelvic floor muscle mobility and relaxation by practicing your belly breathing in different positions, such as deep squat or child's pose, or in sitting and leaning forward over a table for support. The pelvic floor muscles are a hammock of muscles underneath your pelvis. They attach at the front of the pelvis to the pubic bone and span backwards to attach at the base of the spine around the sacrum and coccyx. The opening of the bladder, vagina, and the bowel all pass through the pelvic floor, and they help to support the weight of your pelvic organs. It is beneficial to do your pelvic floor exercises regularly to maintain and build strength and endurance. How to do pelvic floor exercises. A pelvic floor muscle contraction is performed by closing and drawing up your back and front passage. Imagine you are trying to stop yourself from passing wind and at the same time trying to stop your flow of urine. Then draw up inside as if you are trying to lengthen your vagina. The feeling is one of squeeze and lift. In the beginning, it may be easier to do the exercises in lying, but you can progress them to sitting and standing. There are 2 types of exercises you should do. Quick and strong, squeeze as hard as you can and then relax completely. Rest a second and then repeat up to 10 times. Endurance, squeeze and hold for up to 10 seconds. You must feel the muscle relax after each contraction. Aim to repeat it as many times as you can, building up to a maximum of 10 times. Do not pull in your stomach excessively. Do not squeeze your legs together. Do not tighten your buttocks and do not hold your breath. You must aim to do these exercises at least 3 times a day. Generally, it takes 3 to 6 months to get a muscle really strong again. Do not do so many that the muscle begins to ache. Remember, it is quality, not quantity. The pelvic floor muscle exercises do not take long. They can be done when sat in traffic, in a meeting, or when watching TV. Just ensure you make them part of your daily routine. If you are unsure of how to do your pelvic floor muscle exercises, then please do ask for help and support from your physiotherapist. It is important to exercise your abdominal muscles postnatally to help re-engage your core control. The first recommended exercise is for your deep tummy muscles. Lie on your back with your knees bent up and your feet flat. Keep a gentle, natural curve in your lower back. Breathe in, and as you breathe out, engage your pelvic floor muscles. Gently draw your tummy button in towards your spine. Hold this for a second or 2, then relax and repeat 10 times. Also repeat holding for 10 seconds whilst breathing normally. Relax, then repeat 3 to 5 times. The next is a pelvic tilt. Lie on your back, knees slightly bent, and place your feet flat and hip width apart. Breathe in, and as you breathe out, engage your pelvic floor muscles. Gently draw your tummy button in towards your spine. Now gently tilt your pelvis as though you were zipping up your trousers and flatten the small of your back into the bed. Release down slowly and return to the start position. Make sure you do not hold your breath. The next exercise is a bent knee fall-out. Start on your back with your knees bent and feet hip distance apart. Breathe in, and as you breathe out, engage your pelvic floor muscles. Gently draw your tummy button in towards your spine, then gently lower your left knee out to the side, keeping your right knee still and upright. Try not to move your pelvis throughout the exercise and avoid any movement side to side. Return your leg to the starting position as soon as you detect movement in your trunk. Relax your tummy muscles. Repeat 3 times each side and build up gradually. The final exercise is a heel glide or slide. Lying on your back with your knees bent and feet hip distance apart, breathe in, and as you breathe out, engage your pelvic floor muscles. Gently draw your tummy button in towards your spine, then gently slide the heel of your right leg along the floor away from your body until your leg is straight. Then bend the knee again and slide the heel back to the start position. Relax the tummy and pelvic floor muscles and repeat the exercise again with the left leg. Repeat 3 exercises each side and build up gradually. Your diastasis recti should improve with time if you follow this advice and do regular exercises. If you have any questions relating to your diastasis recti or need further advice or support, then please do not hesitate to refer to our perinatal pelvic health services and request an appointment with a qualified physiotherapist.